So welcome to today's systematic review webinar. To start, I'd just like to let everybody know that this session is being recorded and we'll share the recording later on. Now, before we also commence, I'd like to start with a welcome to country. We would like to acknowledge the traditional custodians of the lands within the University of Newcastle's footprint area, which are the Awabakal, the Darkinjung, the Biripi, Worimi, Wunanara, and Eora nations. We also pay respect to the wisdom of our elders, past and present. Now, I'd like to introduce to you Jessica Birchall. Jess is a Research Liaison Librarian here at the library, who will be running today's session. My name's Nicole. I'm also one of the Research Liaison Librarians. I'm going to monitor the chat for today. So if you have any questions, please do pop them into that chat box. I'll take note of them and we'll cover them at the end of Jess's presentation. So I'd now like to hand over to Jess to commence the session. Thank you.
Thank you, Nicole. Thanks everyone for joining me today. So as Nicole mentioned, I'm a Research Liaison Librarian. I'm part of a team of 4. So each of the liaison librarians take care of a different school. So if you want to get in contact with us about today's session, or if you're doing a systematic review and need assistance, just have a look on the library website and you find your school so we can see that everyone is responsible for different schools, and just contact the Research Liaison Librarian that's associated with your school. So today we'll be looking at what is and isn't a systematic review. I'll be taking you through the steps on how to conduct a systematic review. And along the way, I'll be showing you where the library will be able to provide you with assistance when you're doing that systematic review. So a systematic review identifies, selects, and critically appraises research to answer a clearly formulated question or a research topic. Systematic reviews seek to collate evidence that fits pre-specified eligibility criteria to answer that research topic. So a systematic review should follow a clearly defined protocol where the criteria is clearly stated before the review is conducted. So the protocol aims to reduce bias by documenting in advance the explicit systematic methods to be used when searching for relevant material. Now, the search in a systematic review needs to be really comprehensive, transparent, and conducted over multiple databases. It involves planning a well thought out search strategy, which has a specific focus and answers that defined research topic. The search terms and search strategies, including your database names, where you're searching, the dates of the search, and the limits that you've included in your search, they all need to be included in the review so they can be reproduced by other researchers. The review identifies the type of information searched, critiqued, and reported within known timeframes. So systematic reviews have become crucial in the evidence-based practice of healthcare professionals particularly. They're often used as the basis for the creation of clinical guidelines. So most of the resources I'll be referring to today relate to the health disciplines, as they're the group that mainly perform systematic reviews. Systematic reviews are, however, also increasingly being used in other disciplines, so psychology, education, and engineering. If your supervisor or research group have written systematic reviews before, ask them for a copy and get reading to find out how a systematic review is structured. I'd also recommend finding other systematic reviews so you can, read them and learn how they're structured and constructed. So the term systematic review is sometimes bandied about when it shouldn't be, because as we can see here, there are lots of different types of reviews. So make sure you discuss with your supervisor or your research team to describe what they're looking for and how they'll conduct the review. Ask them how long they expect it to take. This will give you clues about the type of review you're expected to conduct or participate in. If they suggest that the systematic review is only going to take a few weeks, you're probably not doing a systematic review. You might be doing something shorter, like a rapid review or a scoping review. Because as I mentioned, a systematic review is sort of a really in-depth analysis of a lot of research on a topic. So it's not something to be entered into lightly, and it's not something that will just be, a quick, a project that will take a month. It will take a long time. In a previous webinar, we've talked about literature review. So I just thought I'd do a comparison between the two so you could see what a systematic review is and isn't. So this table is available on the Systematic Review LibGuide that's on the library page. And it just takes you through the difference between a systematic review and a literature review. So we can see here that a systematic review is really focused on a particular topic, whereas a literature review doesn't necessarily have to be related to a single question. It can be an overview of a particular topic. A systematic review requires a protocol, and for a literature review, no protocols required. So a systematic review really needs you to outline your clear objectives, your inclusion and exclusion criteria before the systematic review is conducted. And for a literature review, there might not be any objectives within the review, and there doesn't have to be criteria specified. Again, for selecting articles, for a systematic review, it needs to be really clear and specific why you've included those particular articles, and that's not necessary in a literature review. Same thing with evaluating articles. It needs to be clear and documented, and that's not the case. It doesn't have to be that way in a literature review. So you can see for a literature review, it's sort of unstructured and it can be about a broad topic, whereas a systematic review needs that protocol. It needs to have definitions. It really needs to be defined before you begin your systematic review. It's a really structured thing. So you're definitely not alone when you're conducting a systematic review. It is a very big and daunting task, but the library is here to help you. So throughout the presentation, I've just included these ticks. So wherever you see one of these ticks, the library can provide you support during your systematic review. So keep your eyes peeled for the ticks. So now I'm just going to go into the steps of how to conduct a systematic review. So number one, we need to identify your research topic. So you need to develop a clear and focused research question that will guide the systematic review. This could be guided by your supervisor or your research group. You could also start by choosing a broad topic and that you're interested in and do some quick searches on the research in that field to see what's been researched already. And you can have a look to see if there are obvious questions or gaps in that research that you might be able to investigate more with a systematic review. Some people conduct like a literature or a scoping review to identify those gaps before they conduct a systematic review. So a technique often used in health research for formulating a clinical question is to frame your question around this model here, the PICO model. So the PICO model categorizes your question into the following 4 elements. So there's patient, intervention, comparison, and outcome. So there is the Cochrane Handbook for Systematic Reviews. It includes a detailed list to consider when developing your research topic using the PICO model. Now, once your research topic or your question has been decided, it's really important to evaluate it because you need to ensure that there will be new knowledge that comes out of your research. You need to establish that the question is really clear and specific, but you also need to make sure that the question isn't too broad or too narrow. So it's really important to find a balance between that. If it's too broad, there'll be too much information for you to wade through. And if it's too specific, there might not be enough information for you to find and research. So before you begin your systematic review, once you've developed your topic, have a look to see if there are other systematic reviews or protocols that are already out there or that are being worked on. You don't want to get to the end of, that really long journey and then find out that this research already exists. So you can search for existing protocols and systematic reviews via Prospero, Cochrane, and the Joanna Briggs Institute, so JBI. You can also look at sort of other databases, health databases. You can limit your searches to just reviews. Systematic review will often be in the title of the systematic review, so you could try a title search using that and see what you come up with. So the second step is to develop your protocol. Now, as I mentioned earlier, the protocol is the detailed plan for your systematic review. It explains your topic, your search methodology, and your rationale. The protocol should be developed at the beginning of the review, but it can be refined as you go along. So there are guides available out there that will take you through how to write a protocol. So there are guides available through JBI, Prisma, and Cochrane. There is a Cochrane handbook that's available online. They outline how to construct your protocol. So generally, your protocol should include your rationale and your objectives, what you hope to achieve in the systematic review. It should include your eligibility criteria. So these are the inclusions and exclusions for your review. Your search strategy and where you will search. So what databases are you searching in, and are you including grey literature? They will also include how you will screen, extract, manage, and analyse your data. Now, this is something that you'll need to discuss with your supervisor or your research group, because that process can differ from team to team and from project to project. Now, you can publish your protocol. So some journals do, some don't. If you're interested, you need to check the journals in your field. There are other databases that specialise in reviews and protocols. These same names are being mentioned again and again. So Prospero, Cochrane, JBI publish protocols and systematic reviews. Another option to publish your protocol is the Open Science Framework. This is free. This is it's another option because they also allow the publication of scoping reviews. So it's just another option for you to keep open, because Prospero doesn't publish scoping reviews. So the Open Science Framework is just another option available for you. So we're up to part 3 of the review, possibly, one of the most, key elements of a systematic review. And this is the area where the library will provide you with the most assistance. So this is when you're looking at creating your search strategy for your systematic review. So now that you have your research topic, you need to separate that topic into the different subjects, elements, topics. And from there, you can build a synonym or a search term list within each of those topics. So if you use the PICO method to create the question, you can use that same method to help separate your research question into the different topics. If you didn't use the PICO method, there are other models out there that you can use. So we have PICO. There is also PICOS, which includes an S at the end. So that S stands for study type. There's also the SPIDER method, which stands for sample, phenomenon, interest, design, evaluation, and research type. So all these models are available for you to look at online. You don't necessarily have to use a model, but what is really crucial is that you need to identify all the concept areas within your research question. So I'm going to show you an example. So our research question here, our research topic is, what is the effectiveness of bed rails for preventing falls among older adults? And you can see here, we've used the PICO method to separate that question into the different topics. So our patient, our P, is older adults. The I, the intervention, we're looking at bed rails. We don't have a comparison. The outcome that we'd like to measure is preventing falls. So we have prevention of falls. So now that we've separated our question into the different topics, we need to build a synonym list within those topics. So building a synonym list is important, as an effective search strategy needs multiple terms to ensure that you find the most relevant material for your review. You cannot rely on just one term to cover a topic, as different databases use different search terms. It's also important to use a mixture of subject headings and keywords in your search, so you can capture things that haven't been indexed with subject headings correctly. Just be aware that different databases use different subject headings and terms, so it's important to have a mixture of the both. So things that you'll need to consider when you're creating your synonym list are the types of words that are used in medical journals versus other academic journals. Things like technical medical terms versus generic terms, general terms. Is your term known in a different way? Do they use an acronym? Is the term recognised internationally, or do they use a different term in different countries? For example, young adult in Australia might not be recognised as much in the US as the term juvenile could be. If you're including sort of those international terms, also make sure you think about international spelling, so US, UK, that type of thing. If you're having trouble coming up with some terms, if you've done some sort of general searching in that area and you've noticed particular subject headings or keywords that have been coming up across multiple databases, if you've already got some articles that people have given to you, or that you've found that you want to include in the review, think about have a look at the subject terms and keywords that are used in the title or the abstract that you could use. You can also look at Cochrane reviews, as most of the Cochrane reviews include the full searches from all the databases in the reviews. The Cochrane search strategies are also peer reviewed, so the search terms have passed quality checks. Just be aware that if you're looking sort of at an older review, that you need to be aware that maybe some of the subject headings have changed since the time it was published. So while you're drafting this list, it's a good idea to think about the most efficient way to enter this into a database. So think about, truncations, wildcards, and maybe possible filters that you could think of using when you're doing your search. So for our question, we've separated the question into the different topics. We're sort of building up a list of synonyms. So we have bed rail as 1 word and 2 words, side rail, cot side, safety rail, physical restraint. So we can see this little asterisk here. That's a truncation symbol. So truncations are a really great way to capture plurals, and they also capture any variant of the word from that truncation symbol point onwards. So things to think about when you're using your truncation symbols, you need to be careful where you place the symbol. So we have a truncation symbol after fall. So that's going to capture falls, fallen, and falling. If you enter in a truncation symbol too early, so for example, bed rail, if we put the truncation symbol after the D, we're going to pick up words like bedroom, bed sores that don't actually relate to our research topic. So you just need to be careful where you put your truncation symbols. So the reason we're doing this, separating this, is also because it makes it easier to combine your topics when using the Boolean search strategies. So the Boolean search operators are or, and not. I tend to not focus on not, particularly during sort of initial searches, because it's too limiting and mistakes can often be made when it's used. So what we're going to do with the or Boolean operator is we're going to connect all those synonyms within one topic. So for our bed rail topic, we're looking for bed rail as one word or two. We're looking for side rail. We're looking for safety rail. And then with the and operator, we're going to connect all those terms together, connect all the different topics together, because we want to find research that includes something on bed rails, something on older adults, and something on falling, prevention of falls. So you're separating that so you can combine them all nice together so you can find research that will include every element of your question. So deciding where to search, this should be thought about when you're developing and drafting your protocol. If you're unsure of where to search, there's a systematic review guide on the library homepage. As I mentioned earlier, that focuses on sort of health resources a lot. You can also look at your subject resource guides for suggestions on where to search. The systematic review guide has a quick comparison guide that lists sort of the top health databases, outlines what they contain, and shows search tips on how to search in those databases. The A to Z database list on the library homepage, it also gives you a description of what is in each database. Just remember to get to those databases, it's always best to go through the library website, particularly if you're off campus, as that provides you with the easy proxy link, which will give you to access to resources as a University of Newcastle staff or student member. Hand searching is also a really good way to pick up some resources. If you've been recommended articles or you've found articles already on what you want to include in your systematic review, have a look at the reference list within those articles and sort of follow the trail. Generally, people include around 4 to 5 databases in a systematic review. That's sort of not a hard or fast rule. And depending on your research topic, you'll want to include the best databases that cover the topic and give you a variety of resources. So some good health databases are the ones that are listed below. So there's 3 that are provided by Ovid, Medline, Embase, and PsycInfo. Sonal is a good one, and Scopus is also a good one. It's a citation database, but it gives some great information regarding the scope of the research around your topic. So if your review crosses disciplines or subjects, so if you're doing a health review with an educational or a technology or an engineering slant, you might want to add a discipline-specific database to the mix to make sure you cover all aspects of the question. Just be aware that the minority databases might not yield as many results as the others, and they'll also use different subject headings and keywords. If you're including grey literature can be slightly harder to capture. There are several grey literature databases mentioned on the systematic review guide on the library homepage. You can also find material, hand searching and through Google Scholar. As grey literature is sort of harder to capture, you need to make sure you allow yourself time to find that information because it does take a little bit of extra time. So once you have your search strategy, it's time to do sort of some test searches. And for health systematic reviews, I really recommend testing out your complete search strategy in Medline first, as it's a really thorough database. It also shows your search strategy and results in a really clear way. And it's one of those databases that lets you save and share your search strategy the easiest. It brings it up in a nice, easy to read table that you can just copy and paste into a Word document. So this sample search in your first database is really critical. This is where you'll need to tweak your search strategy to get the best results. And once you're happy with that, you can then replicate that search across different databases. So time spent here perfecting the search, consulting with your supervisor colleagues and your research liaison librarian is really worth it to avoid potential problems later on if terms are missed or concepts are not combined correctly. If you're using subject headings, so mesh subject headings, for example, it's important to use a mixture of those subject headings and keywords in your search so that you can capture things that haven't been indexed with subject headings properly. Now, this is a problem in Medline, particularly in sort of the newer research that comes out. So anything, close to present, it takes a while for subject headings to be indexed to particular articles. So if you have a mixture of subject headings and keywords, you're really not going to miss those particular articles that you're looking for. If initially you run your search and it's too big, you can start thinking about adding limiters in the search, like publication dates, if you're only looking for sort of the most recent research. If your review is only looking at specific study types, you can limit your search by that. If your review is looking at only specific countries, you could include a limit that way. Just be careful when selecting the limiters that are provided by the databases. They're a little bit like subject headings in that they can be sometimes indexed incorrectly or not in a way that you would think. Often people index using human as a limiter, and sometimes that can miss a lot of things that are related to your topic. So I mentioned, if your search result is too big, there's sort of no magic number. We get asked a lot, what's an ideal number? That can differ from each systematic review. What's really important is that while you're searching, you're not just focusing on that number, you're looking at the quality of the results that you're getting while you're searching. So you need to be assessing and having a look at, are you capturing material that can be included in your review? A good way to test that is if you have articles set aside for your review that you want to be included in your review, have a look to see if those particular articles are coming up in your search results. If they are, you're on the right track. If they're not, you need to investigate why this is happening. And again, this is where your librarian can help you. As I mentioned, so the librarians can help you here, and I've got seek advice twice because this sort of test search phase, it's really important to get as much advice as possible so you can make those tweaks and changes. Talk to your supervisor, talk to your research group, make an appointment or send your research liaison librarian your search strategy to see if we have any suggestions, if we can add terms or make things a little bit clearer for you. This is a really great time to get that advice. So while you're running these searches, it's really important to document and save your searches as you go. Most databases allow you to save your searches after you create a free or an individual account. Make sure you save your searches continually so you can document and keep track of the different searches. Come up with a naming strategy, a naming convention for your searches so you can find the search that you want easily. Documenting your searches, so showing what specific search terms you've used in each database. That can be tricky depending on, it goes from database to database. As I mentioned earlier, like Medline, so anything in Ovid, it brings up your search strategy in a really handy, nice table, but that differs from database to database. So once you've come up with, a good number of results that relate to your topic that you want to include in your systematic review, it's a good idea to manage those search results via EndNote. So you can bring across those results from databases easily. You can organize them how you want to. You can organize them by database or subject heading, subject terms, whatever you like. EndNote can also, when you're doing searches across multiple databases, there will be some duplicates. So EndNote can duplicate your results for you. It's important that when you do that, you don't just rely on EndNote doing that. So when EndNote does the deduplication process, it relies on an exact title and author match. And because you're bringing across stuff from different databases, the formatting could be different. So if it's not exactly the same, it often misses some duplicates. So a good way to avoid that is to run the deduplicate process in EndNote first, and then do a manual search yourself within EndNote. So sort your list by title or author, and then go through and manually check for duplicates yourself. EndNote can also help you find and get access to the full text, so the PDF of your resources. Your Research Liaison Librarian can also help you find full text for any resources if you're having problems. So there's lots of great resources that we have for EndNote. We've got an EndNote guide on the library website that takes you through step-by-step instructions on sort of basic functionalities of EndNote. There's also an introduction and an advanced EndNote webinar on the EndNote guide on the library website. They're both great resources. You can also contact your Research Liaison Librarian if you've got problems or have a specific question relating to EndNote. So we're getting to the really pointy end, the sticky point of the systematic review. And so unfortunately from here on out, you're going to be seeing less of the librarian ticks. So searching is just the beginning. Once you've found enough material, you need to begin screening. So this is where you evaluate the resources found based on that inclusion and exclusion criteria that you determined in your protocol. So there are two stages of screening. There's a title and an abstract screen. So this is where the titles and the abstracts of the article are scanned to remove sort of those more obvious irrelevant studies. And at this stage, you don't have to sort of provide a justification for why you've excluded that topic. The next stage is the full text screen. So here is where you need to locate the full text of the articles that haven't been excluded already. And you need to carefully examine each one for compliance with your eligibility criteria. Now's the point where the reviewers should document the reason for excluding any articles. Your review paper should also provide details of how many reviewers screened the articles and how disagreements were resolved. So there are screening tools out there to help you through this process. And that's why I've brought up this slide relating to Covidence. So the university has a license to Covidence, which is a web-based tool that streamlines the screening and review process of systematic and scoping reviews. It supports title and abstract and full text screening, risk of bias assessment, the extraction of study characteristics and outcomes, and the export of data and references. So you can use as much or as little of the functions of the Covidence review process to best suit your practice. So Covidence is recommended by Cochrane and JBI, but there are other screening systems out there. The university has a Covidence site license though, which means all staff and students are able to use Covidence to screen for their systematic reviews. Covidence is holding a sort of an introductory webinar in June. So you can contact anyone's able to register for that. So contact your Research Liaison Librarian and we can provide you with details for that. So next step is how to critically appraise your studies. So again, there are no ticks at this point, as this is, the library can't assist you here. So when dealing with your traditional literature reviews, they require a general critical analysis. But for a systematic review, each study that you've included has to be analysed. So you'll need to check if they've followed sound scientific research principles and that the outcomes are valid. Once you've done that, you'll need to extract and synthesize your data. So the extract process involves that once your decision's been made about which articles to include in your review, relevant data from each of those studies needs to be extracted. So this is decided in your protocol stage, and it should be done in a structured way and an organised way, and it'll be presented in your final systematic review report. To synthesize, this is a section of your review where the findings responding to your initial research question are determined. So you'll need to develop a synthesis or a critical overview, which integrates the key findings from all the studies that you've included, whilst also considering the methodological quality and other important factors of those studies. So things like the sample size, the population, or the context in which each one of these studies was conducted. So there are different methods for synthesis. There's narrative or descriptive, qualitative, and meta-analysis. Again, Cochrane, JBI, and Prospero have guides on methods for extraction and synthesis. And finally, we're at the last stage. So the last step is to write and then publish the review. So how you write a review, how you write your systematic review really depends on your audience, your discipline. Again, there are lots of guides for you to follow. The Cochrane Handbook, the JBI Manual for Evidence Synthesis provide detailed high standard styles for systematic reviews. You could look at examples of systematic reviews from a similar field of research published in well-regarded journals. You can use them as a model for how you draft your systematic review. You can check the guidelines and instructions to authors in those specific journals or organisation where you aim to submit your work. If you can't find the information you're looking for, write to the journal or organisation for advice. So there is one final tick here. The library can assist with identifying journals. So we look at criteria such as quality indicators, whether a journal's indexed or peer reviewed, whether a journal's open access or not. We can provide you with information about where's best to publish. So that's it, we've come to the end. So during your systematic review process, the library can help you with evaluating your research topic. We can look for existing reviews. We can help you find where to publish your protocol or review if you need to. We can help you when you're creating and reviewing your search strategy. We can help you find where to search and how to search those databases. We can help you find full text. And we can also help you if you have any EndNote or covenants problems. So as I mentioned earlier, Covenants will be holding a webinar on Wednesday, the 16th of June at 11 a.m. Anyone's available to register for that. That link there is pretty long. We'll be sending you a link along with the recording of this webinar. So if you missed that or haven't found it, you can by all means get in contact with your Research Liaison Librarian. And any sort of questions that you have related to systematic reviews, contact your Research Liaison Librarian. We're happy to help. And that's it. How are the questions been going, Nicole?
We had a couple come through the question area. I've answered most of them, but if you'd like, we could run through them in case anyone's missed them.
Yeah, sure.
So are there any existing protocols in business research?
I don't know.
I thought that protocols were primarily more of a health related field, but have suggested that they make an appointment with the Jenny, who is the Research Liaison Librarian for the business area.
As I mentioned, it's definitely more health focused, but systematic reviews are being used more and more in different fields.
Cool. And someone who had missed what was grey literature. So we've put in the link to the grey literature guide there if you wanted to add anything else about that part as well.
Yeah, just basically grey literature is sort of anything that's not published in sort of a traditional journal. It's generally things like, you know, government reports or any sort of report conducted by a business or an organisation. There can also be things like conference papers, conference abstracts that aren't published in sort of, you know, a traditional way. They're available online somewhere that can be included as grey literature. So it's just anything that you kind of don't find through traditional means in terms of like it's officially published, it has a DOI. So it can cover a lot of material. The thing about those grey literature, there's lots of grey literature databases on the Systematic Review Guide. The search the search box or the search for those are very basic. So again, that's why we mentioned you really need to give yourself time for that, because it's sort of a really basic search that you'll need to wade through some of the results.
Great, thank you. And can we share the slides as well as the recording so that everybody can have the links?
Sure.
Yep, cool.
We can do that.
Great.
That sounds good.
The only other one was about transferring references from databases into EndNote. I've shared the link for the previous webinars that will go through that process as well.
Yeah, on the EndNote guide on the library page as well, there's also a section on how to export from databases, and it takes you through database by database. So I'd recommend that they'd have a look at that as well.
Okay, great, cool. And we've shared in the chat a lot of the links to the library resources that you've mentioned as you went along. And otherwise, there was a couple of thank yous. Oh, hold on, a couple more have come in. I trust exporting to Zotero instead of EndNote wouldn't be an issue through with the databases.
No, we just EndNote's sort of the reference management system that we support. But if you're comfortable with Zotero, that's totally fine. Just gives you a good place for you to have somewhere central for you to organise all the resources that you want to include in your review.
Great. And yes, we will provide a link for the Covenants training on the 16th of June.
Yeah, that'll get sent out with the recording.
Tick.
But if you get missed, feel free to contact any one of the Research Liaison Librarians and we can send it to you.
Great, thank you. And have you used or recommend a program, and I hope I'm pronouncing it correctly, Colandr, Colandr, it is spelled.
No. I'm going to have to look into that. Yeah, no. Can you get their contact details and we can talk to them later about it?
Yes, yep, we'll get that and we'll get back to you about that one. And Ben just answered the other one about, we've sent you a guide for using Zotero, so that's fine. And that's it at the moment. So thank you.
Great. Thank you to everyone for joining. And as we said, the webinar recording will be sent out to you, including those links and including the presentation which has the links included. So thank you everyone for joining.